Good afternoon and welcome to United TV. My name is Kemal Erkan. It's our Bariatric Friday time. We are looking for, of course, beyond weight loss. Obesity can affect blood sugar, blood pressure, sleep, joints, and many other parts of the patient's health. But when we say bariatric surgery, we say bariatric surgery can improve these conditions, what does that mean really for us and for our patients? How quickly can things change, and can those improvements last? So of course we are looking at the longevity of what we do today, and that's the most important part of this. And Dr. Irgau is going to help me today with my questions and for our patients to better understand what those resolutions that's going to be, and that's why we are here today. Dr. Irgau, how are you doing?
I'm doing great, Kamal. Thank you for having me.
Of course, it's always good to have you. And, I have to make the shift change from politics to healthcare again. So it's sometimes a little bit difficult than other times. So now talking about healthcare is always fun because that's what we do. And we know that this is the best way we can actually help. And today's topic specifically is
Important.
important because there are some topics where we talk about risk and the outcome, this and that. But in this one, we actually talk about resolution of comorbidities, those, the bad, siblings, we call them. So the other illnesses, they go away after bariatric surgery, takes care of the morbid obesity problem. So that's why we are going to discuss that today. Now, when we say a comorbidity has improved or resolved after bariatric surgery, what does that actually mean for our bariatric patients?
Well, essentially, that the patient has become healthier. If they have blood work, for instance, their numbers may be better. There may
Mm-hmm.
be improved blood sugar level. There may be improved cholesterol level. When their blood pressure is measured, it may be at a more normal level. And of course, if they've been taking medications, maybe they are taking less medication or no medication at all.
Mm-hmm.
And when we talk about remission, we talk about the fact that that condition is under control right now.
Mm-hmm.
But obviously, as we always say, obesity is a chronic disease, which means that long-term monitoring is necessary because some of these conditions could return if the patient's,
Mm-hmm.
obesity relapses.
So, going into the other parts of this, some patients feel relatively healthy despite living with obesity. And I see this sometimes with the patient with A1C 5.7, and then they're like 380 pounds. I'm like, well, really? Like, how does that happen? So, and this is sometimes they don't realize what they may have, and sometimes the results are not, the lab work may not show everything. And in some cases, we don't know how they are connected to each other.
True.
So, what health problems can obesity be contributing to even before a patient realizes something wrong with them?
Well, very often, the most common ones would be type 2 diabetes, for instance. Patients may not know that they have developed diabetes until the blood sugar go to really very high levels,
Hmm.
especially if they're not having routine blood work. They would not know this and they wouldn't have symptoms from the diabetes until the levels are extremely high. Similar with the blood pressure, right? They may not know that they have high blood pressure because once you start getting symptoms from blood pressure, it may be too late. You may be getting a stroke or other things, right? If you don't have regular checkups.
Hmm.
For sleep apnea, they may start having symptoms because they're sleep deprived. They may be more tired during the day. They may be snoring more at night. But there are also other conditions that very often we forget. And one of them is actually liver disease, right? And this is the so
Hmm.
called fatty liver disease, which we used to call non alcoholic fatty liver disease. It's now called metabolic dysfunction associated steatotic
Hmm.
liver disease. And this is a condition that is actually extremely common nowadays, and it's a very serious
Hmm.
condition which results with from accumulation of fat into the liver. So the liver obviously is a large organ that we have inside of our abdomen, but it's still a fairly limited organ. So if you accumulate fat within the liver, that can actually lead to dysfunction of the liver cells or even to the death of the liver cells.
Hmm.
And that condition is very often silent. And it's said that up to 38% of people in the United States have this type of liver dysfunction. And, in the past, you may remember the most common cause for liver disease used to be alcoholic liver disease,
Right.
right?
So when you say liver, like automatically people would
Automatically, you would
assume,
think, yeah,
yeah.
you're a drinker. No, now actually, the most common cause of liver disease is obesity-related liver disease.
Mhm.
And it's actually approaching uh, alcoholic liver disease as a cause for needing liver transplant. Can you imagine it requiring liver transplant because of obesity-related liver disease? And as I said, many people may not know that they have this condition. And if you look into it, up to 70% of people who have type 2 diabetes have fatty liver disease as well. It is a condition that you wouldn't think of looking at, but its prominence obviously has skyrocketed with the prevalence of obesity as well. So it's one of those conditions that you have no idea you have it until you start looking at the dysfunctions caused by obesity.
Excuse me. So for patients, they understand that losing weight can improve health. Um, what surprises many people is that certain conditions can improve before a large amount of weight loss actually happens. So, why can bariatric surgery improve conditions like type 2 diabetes even before the major weight loss occurs?
Well, it has to do with the metabolic effect of bariatric surgery. In other words, once bariatric surgery is performed with the changes that occur in the arrangement of the digestive system, there are some very important hormonal changes as well.
Mhm.
Those hormonal changes lead to dramatic improvement in insulin sensitivity. And insulin sensitivity, for instance, is the main reason that for type 2 diabetes. And that by itself can lead to improvement of control of blood sugar. So much so that doctors sometimes would find that patients, with blood sugar abnormalities would come to the hospital, have gastric bypass surgery, and the next day their blood sugar would be normal, even before they have lost any substantial amount of weight. This was actually demonstrated by an important paper that came out in 1995 by Dr. Poirier in the University of East Carolina. And the paper title was, "Who Would Have Thought It? An Operation is the most effective treatment for adult onset type 2 diabetes." And that's where he published his series of gastric bypass patients, among whom there were a large number of diabetics whose diabetes improved. And very often the diabetes would go away before those patients left the
Is
hospital.
it just because of when the surgery happened, or is it because we also have a really good prep prior to the surgery?
Interestingly, this was before the era of modern bariatric surgery. So all
Okay.
that prep that we're doing actually was not there. In fact, many of these patients would be on insulin. They would come to the hospital a day or two before the surgery, and they
I
would
see.
stay in the hospital for a few days afterwards. The surgeries were done in an open fashion, right? So it is actually the surgery itself, the changes that the digestive tract undergoes lead to hormonal improvements that improve the whole uh, body's ability to control blood sugar.
Hmm, interesting. I learned something. Even after 5 years of doing this every Friday, I was always thinking that it has something to do with the preparation. Now, not every condition improves at the same level.
Mhm.
So some can happen very quickly, and then some are not, and they may need a little bit more weight loss. So, what are usually some of the first health improvements patients notice right after the surgery?
So, pretty much the conditions that we have just mentioned, type 2 diabetes, high blood pressure,
Hmm.
and very often sleep apnea as well, start to improve, particularly because the weight loss, as you know, is most rapid in the early
Hmm.
days, in the early weeks after bariatric surgery. And patients will see such a dramatic improvement in many of their conditions that the medications may be too much for them, right?
Hmm.
So if there are patients who are, for instance, on 2 or 3 blood pressure medications before bariatric surgery, now suddenly the blood pressure has improved because of the weight loss, and those medications may be driving the blood pressure too far down, and patients may start having symptoms of low blood pressure. So very often we will tell our patients actually to make sure they have an appointment with their primary care doctor within a couple of weeks after weight loss surgery to make sure that adjustments are not needed for medications like blood pressure. Conditions like sleep apnea may take a little longer to improve, but interestingly, sleep apnea is one of the conditions that actually completely resolves to a greater extent after
Mhm.
bariatric surgery. Similarly, if the patient's fatty liver disease has not progressed to a significant level, that also reverses completely after weight loss surgery.
So, do we have a way of checking? Is it like a liver ultrasound? Like how do you know the patient
Absolutely,
has?
absolutely. We check liver ultrasound can give a really a good idea of the extent of the fatty liver
Mhm.
disease. Of course, blood work very often will show also that there are abnormalities related to some of the parameters that we call liver function tests. But ultimately, biopsy is done when, especially when the condition has progressed to really demonstrate advanced liver disease. And we often do that. Actually, you may have seen in some operative reports that we go in to do bariatric surgery, and we find that there is significant abnormality in the way the liver appears. It almost looks as if it has become what we call cirrhotic liver, in which case we take a sample from the liver and we send it to the lab to
Yeah.
try to categorize what extent of liver disease it has
Mhm.
reached.
So many of our bariatric patients, they enter surgery taking medications for diabetes, high blood pressure, or other obesity-related conditions.
Yes.
So how quickly can medication needs change after surgery, and why is so close? Why is the so close medical follow-up important for those situations?
So essentially, the time of greatest weight loss is the early weeks after bariatric surgery, right? We see really rapid weight loss at that time. With that rapid weight loss, there is going to be improvement in many of these conditions as well.
Mhm.
As I said, for type 2 diabetes, the improvement may occur even before significant weight loss has happened. So it is important that regular checkups are undertaken. As you know, we see our patients very frequently
Mhm.
early after surgery. But in terms of adjusting their medications, particularly the ones who have uh, a fair amount of medications for high blood pressure and there are medications for type 2 diabetes, we want them to follow up with their primary care doctor soon because the medications may need to be drastically reduced.
Sure. Now, obesity-related diseases can become more difficult to reverse after they have been present for many years. We see this all the time. Can waiting too long to treat obesity make someone comorbidity harder to improve or put into remission?
Absolutely. Absolutely. Kamal, this is a very important point. It is an important point because it really goes to the idea that bariatric surgery not only is a necessary procedure, but sometimes it's a fairly urgent procedure, right? We have seen from studies, for instance, when you look at how type 2 diabetes improves after bariatric
Mhm.
surgery, you can see that patients who've had type 2 diabetes for more than 5 years will have a harder time improving or resolving their type 2
Mhm.
diabetes. More importantly, the patients who've had type 2 diabetes for the longest, even if the type 2 diabetes resolves early after surgery, the diabetes may come back again,
Mhm.
right? So when we look at the resolution of type 2 diabetes, we see that the ones on whom the resolution is early and permanent are the ones who are having bariatric surgery very soon after they have been diagnosed for type 2 diabetes. If they've been diagnosed for type 2 diabetes for a long period of time, or worse, now they are dependent on insulin for their diabetes,
Mhm.
the chances of their diabetes resolving completely are much lower. And even if it disappears, it can reappear again later. And this has to do with the fact that the longer the type 2 diabetes has happened, the more likely it has that the pancreas cells that produce the insulin
Mhm.
will have been destroyed and they cannot produce enough insulin,
Damage, I guess. Like,
damaged permanently,
so when
essentially.
you have the body has to live with that, those conditions, like they're not like not harming, right? So they're harming
Absolutely.
every day they're there. Those
Absolutely.
conditions are there. There's some harm. So That's why some people live shorter than the others, and the damage is already there. So then that's why taking earlier action is important.
And that is very, very impertinent for non-alcoholic fatty liver disease that I was saying earlier on as well, because there is progression. There is progression from just pure fat accumulation to inflammation of the liver cells to destruction of the liver cells, and then complete scarring of the whole liver that may require liver transplant for that person to be able to survive, which means that the earlier you intervene,
Hmm.
the better chance there is for that person to preserve a healthy liver, right? So people need to understand that waiting with obesity is not only harmful because your quality of life is miserable
Hmm.
for a long period of time, but your chances of improving your health also are less if you wait and stay with obesity for a very long period of time.
So the labs are important, and patients often see improvements in these numbers. And what everyday changes do patients often notice when their obesity-related health conditions begin improving?
So essentially, they will be taking less medications, right? Many patients will come to us with really a pile of medication that they have to take to treat this or that condition, right? Whether it's high blood pressure, whether it's type 2 diabetes,
Hmm.
whether it's heartburn, whether it's stress urinary incontinence, many conditions. And they may be on a CPAP machine for the treatment of sleep apnea as well, right? And they may be taking pain medication because they have joint problems. They may be taking medications for mental health because the depression that goes along with obesity, the anxiety that goes along with anxiety, all those conditions will improve. There is much more comfort in the quality of life, but also there is much more,
Hmm.
there is improvement in those conditions as well, and they will feel that on their everyday life.
So what we see with our patients, they measure the success of the surgery itself by the amount of weight loss happens. So, but what we know is that scale doesn't always tell the entire story. So, can a patient still be getting major health benefits even if their weight loss is slower than they expected?
Absolutely. Absolutely. So, and that is actually ultimately the leading measurement for us as healthcare providers is not only looking at the scale, but to look at the health parameters, right? Look at the hemoglobin A1C, look at the blood pressure, look at the cholesterol level, look at the how healthy the liver is. All those parameters are very, very important. And granted, of course, the scale is very important to patient. The weight and the burden of carrying that weight is obviously a major issue for the patients. But it's important to understand that in terms of long-term health and
Hmm.
longevity, the health parameters are far more important than the actual weight loss.
So, the improvement in diabetes,
Mhm.
hypertension, or sleep apnea can be life-changing. So, but bariatric surgery remains part of the long-term treatment. So, once a comorbidity improves and goes into remission,
Yes.
what should patients do to protect those results long-term?
So essentially, it's all about adopting a healthy lifestyle that will lead to no weight regain, right? And also constant follow up with their caregivers to make sure that their nutrition is appropriate, that they have appropriate guidance, okay? And then blood work is undertaken
Hmm.
on a regular basis as well. If a patient starts eating unhealthy and the weight starts coming back
Hmm.
up, all those problems that were associated with obesity are likely to show up again, right? So that's why when we talk about bariatric surgery as being a tool, that's exactly what we mean, right? It gives you a tool to get rid of obesity, to get rid of those
It's a
conditions.
very powerful tool,
It's a very
right?
powerful tool, but in the long term, adapting a lifestyle that is conducive to getting rid of this for the long term is very important, which means that they have to be very conscious of what they
Hmm.
eat, not only how much they eat, but what they are eating. They have to be able to be physically active. Physical activity is extremely important, right? Now, just doing physical activity when you're morbidly obese will not get rid of obesity.
Right.
But physical activity after bariatric surgery will help greatly to maintain that weight loss in the long term.
So one of the other things that we should also mention, which is, when we talk about hypertension, diabetes, liver, those are all physical, changes,
Yeah,
physical, or we can, you know, they're kind of like tangible, so
organic.
organic,
Yeah,
but depression is not.
right.
And sometimes, tying depression into morbid obesity, many people fail to understand that.
Mm-hmm.
And living with that for so long
Mm-hmm.
is like
Draining.
just like living with any
Yeah,
conditions, any illnesses too long has major, major, major issues.
absolutely.
So, can we also talk about the depression issue and how that's improving after weight loss?
Absolutely. So there is no question that once you struggle continuously with
Hmm.
obesity, it is likely to affect mental health as well, right? Because not being able to overcome it somehow creates a sense of guilt. There is the stigma of obesity that goes along with it,
Hmm.
and not being happy with the way you look, not to mention of the fact that now you are having to take medications for different conditions, right? That by itself can be very oppressive. And bariatric surgery can be very liberating in that sense because now you are able to feel good about the way you look, confident about the way you live, right? And also the fact that you don't have to take medication for different conditions. So that by itself is liberating. Depression is very closely associated with obesity in many, many ways, right? And so addressing obesity will go a long way to address that as well. Now, as we have talked about in many of our
Hmm.
sessions, there could be mental health challenges that come up with losing weight by itself as well, particularly losing significant weight, which means that having a constant follow up with your caregivers, getting the appropriate counseling is very important before the surgery, but also after the surgery.
So, um, there will be a session that we are going to do where I'm going to ask you specific clearances that we have to go
Sure.
through for the surgery, and like how intertwine these different things, comorbidity, clearance, other things, all those needs to be all happening. Now, one of the issue that I see people don't understand,
Mhm.
and I want to take advantage of the session so then repeating is fine. They really don't understand what sleep apnea does.
Mhm.
So, well, for us specifically, right after surgery, there is the risk of for first maybe couple days,
Yeah,
but long-term sleep apnea is someone may be sleeping 10 hours and then they are still not getting enough sleep.
absolutely.
So the quality
Absolutely.
of the sleep
Yeah.
is also one of the main factors of how we feel
Yeah.
overall, because this
Yeah.
is the time that we actually energize and then re-energize
Yeah.
and start the day. That's not happening.
Right.
So, we look at it from the surgical risk initially, but from the comorbidity standpoint, the sleep apnea is probably as bad as like uncontrolled diabetes or uncontrolled hypertension. It's just bad, but it's kind of underrated, so people really don't have a good understanding.
Absolutely. Absolutely. And of course, there is the issue of not getting enough sleep. There is the issue of the quality of life not being good. There is the issue of falling asleep on the wheel when you're driving,
Hmm.
which is very, very serious, right? But more than that, the other conditions, the other things that people don't understand is that sleep apnea creates a huge strain on the cardiovascular system,
Right.
right? One of the parameters when we check the stop bank score, if you remember,
Hmm.
is the person on high blood pressure medication, right? One of
Right.
the parameters, we talk
Hmm.
about, are they snoring?
If they're
Are they
smoking, the BMI,
their
yeah.
body mass index, their age, their gender, right? But one of them is also blood pressure, and that is because of the strain of sleep apnea on the cardiovascular system, right? And there are situations, and in the past, before sleep apnea became such an, well recognized problem, people used to die in their sleep, Kamal, and people would say, "Oh, he had a heart attack," right? Very often, that
Mhm.
person might have been a morbidly obese patient. Well, what has happened is that patient has had unrecognized sleep apnea, right? And they died in their sleep because of sleep apnea.
Right. Right.
So there is a real danger of going to bed and not waking up when a person has severe sleep apnea. It is that important.
Like when they say that, oh, the person's dying in their sleep. Well, it's not because it was just peaceful. They couldn't get enough oxygen.
Absolutely,
So,
absolutely, absolutely. What happens with sleep apnea essentially is
mhm,
there is because the person stops breathing for so long, there is an accumulation of CO2 in their blood, and that can depress the brain, that wakes the person up
mhm,
when there is not enough oxygen, to a level where they don't wake up at all. And then if you add any type of sedative, whether it's alcohol, pain medication, or
mhm.
others, then the condition could be very
Absolutely,
lethal.
absolutely.
Yeah.
So, well, again, the comorbidities, resolution of comorbidities is, is the fun part to talk about because, the patient goes through a lot of difficulties, and then uh, understanding that this is not just one problem that they have, but it's going to impact several other issues that they have in a positive way. This is why we need them to take an action, reclaim the life that
A-
we have. So
Absolutely.
that should be so precious for us. When you ask, like, there's this guy who's apparently millionaire, spends several million every month to stay young and increase his longevity. Then we have our patients with so many problems that
Okay.
can actually immediately get to the resolution by choosing the right tools.
Absolutely.
And
Absolutely.
like when I'm reading that, and when I look at some of our patients, kind of struggling, how should I do it now? Should I not? This is the most important part of the fight for morbid obesity. So take advantage of this.
Absolutely.
Now, the surgery is still one part of this puzzle equation, but then uh, staying healthy, keep the momentum going. These are all important. So today on Rated with Dr. Irgau,
All right.
we are gonna do the rating on random foods for bariatric patients,
Mm-hmm.
and we'll try to make sure that we can give good guide for our patients. So this is Ethan's favorite uh, part, right, Ethan? Yep. Yeah. Ethan is out of energy on Friday. All right, starting with grilled salmon.
Excellent. 9 out of 10.
Hold on one second, Dr. Gasso. I see. So you're on the vitamins. So
I
uh,
have grilled salmon as well on the
no,
picture here.
that's from last week. It's okay. We'll cut it. We'll cut it later. All right. So
So
uh,
grilled salmon. Are we on it? Yeah.
well, like I did have some food before the session started today,
Grilled salmon.
so then I wouldn't have to run into the McDonald's situation. But that's kind of like, again, like, how we are making choices, right? So I had, like we shared some of these last week. Um, I spied on Dr. Picard. So we do bad choices when we are not prepared.
Sure.
You know, when you have a really good thing and 19-hour intermittent fasting, all of a sudden you crash into McDonald's because you didn't do something prior, then that's how the prevention is important. So you need to take certain precautions and then plan so then you are not getting into that. So today I had a small um, eggplant parmesan sandwich. So I'm not so hungry. I'm not going to order
That's
any
much better than
junk food.
McDonald's, right?
Yes, much, much better. So I think we are ready, right? No problem. So grilled salmon is our first one.
Yeah. Excellent choice. 9 out of 10. Excellent protein plus omega-3 fats. It supports cardiovascular health. Uh, slightly more calorie than lean fish, obviously, so we have to be careful with the portions. But in terms of its choice for our bariatric patients, it's excellent. It's soft, it's protein rich, and it's very well tolerated by bariatric patients. It's a question of making sure that the portions are appropriately small.
All right. So sugary breakfast cereal.
Bad choice.
Bad
2 out of
choice.
10. Processed cereal made from refined grains and added sugar, usually eaten with milk. There is low protein, low satisfaction in terms of satiety, and it's rapidly absorbed carbohydrates. This is poor choice for our bariatric patients, and it can definitely cause dumping as well.
So dumping is bad. So next one, the Turkish superfood lentil soup.
Superfood indeed. Excellent. 8 out of 10. Lentils, vegetables, broth with seasoning, and sometimes added meat. It's a good source of fiber. It's a good source of plant-based protein. Excellent source of minerals as well. It's very good for our bariatric patients. It's soft, it's filling, and it's nutritious.
So the lentil soup is part of the Turkish culture. So there are certain restaurants, they only serve soup, and the lentil soup is one. So like especially like the winter days. So you are hungry and then you go to a restaurant and the first thing that you order is lentil soup. So
Great choice.
it is a good choice.
Yeah.
And the Italian disaster pepperoni pizza.
Bad choice. 3 out of 10. Look, it's refined flour with crust, tomato sauce, cheese, and pepperoni. So highly refined carbohydrates, saturated fat, lots of sodium, a lot of calories as well. It's a poor choice for our bariatric patients.
All right. So the next one is the Friday special edamame.
Excellent choice. 9 out of 10. It's soybeans served really steamed or broiled. Provides high quality plant-based protein, lots of fiber, unsaturated fats, and important micronutrients. For our bariatric patients, it's really an excellent choice. Shelled edamame is an excellent snack for our patients.
Ethan, do you know who also loves edamames? Joshua.
Really?
He goes crazy for those. Yeah. So
That was a surprise for me as well to see that. Yeah.
Well, he is a doctor.
so and also the next one he likes it too. So that means he's not really expert on how to food French fries.
Bad choice. 1 out of 10. Potato strips deep fried in oil, usually heavily salted as well. It's really refined starch plus added fat and sodium with really no meaningful protein in it. It's a pretty bad choice for our bariatric patients. It's easy to eat quickly, it's calorie dense, it displaces their protein, which should be the first thing that they should be eating.
It's so interesting how potato can be a superfood if it's boiled and like or just in the if it's
How it's
baked.
prepared, right?
But if it
Fried,
becomes the
yeah.
fries,
Not so good.
it's not so good. All right, so the today's superstar, I believe, is coming: grilled chicken and vegetables.
Excellent. 10 out of 10. Lean grilled chicken served with non starchy vegetables such as broccoli, zucchini, peppers, or green beans. It's an excellent lean protein with fiber, minerals, and vitamins. For our patients, it's ideal. It's really the textbook protein rich meal that we would want our patients to have.
All right, so the next one is a juice, and it's the orange juice.
3 out of 10. Juice extracted from oranges with most of the whole fruits fiber removed. Provides vitamin C but delivers concentrated liquid carbohydrate essentially with little fullness.
And does it make any difference if it's fresh or just?
It does. It does.
Mhm.
If they have to drink juice, I advise our patients to have the oranges squeezed to themselves and drink it that way.
And the next one is the superfood for vegans and for me too. So I do like avocados. Avocados.
Excellent. 8 out of 10. creamy fruit rich in monounsaturated fat, fiber, potassium, and micronutrients. It's excellent fat quality, and it's really satisfying. But the calories can accumulate very quickly. Essentially, it can be calorie dense, so portions are important.
So
But it's a very good choice for our
that
patients.
picture can stay. So one thing that I want to say about avocados, like just the way that you see it on that picture, once you take the seed out,
Hmm.
just have a little teaspoon and just a little bit lemon on it and some salt. It's like if you are really hungry and then you don't know what to do, and if you have avocado, that's a good way to just have one.
I agree. I
Yeah.
agree. That's a great, excellent way to satisfy hunger quickly.
All right. Uh, Deli, deli turkey.
7 out of 10, reasonable. Pre-cooked sliced turkey, ranging from minimally processed to
Oh, you did.
uh,
You did.
highly
You are generous
processed
for
daily meat.
turkey. Is it because of I'm from Turkey? Is that why?
Partly.
Okay.
No, I'm
So you got
kidding.
extra
I'm
points.
kidding. Convenient. It's convenient. It's protein rich, but particularly with a highly processed daily meat, we have to be careful about the sodium. With it, and this can be variable depending on the brand. So for our bariatric patients, I would say it's a good choice that they can have from time to time.
All right. So we are at the end of our Rated with Dr. Irgau session. So thank you
You're
for joining
welcome.
us first. I believe today's message is important because bariatric surgery is only about what happens on this. It's not only what happens on the scale, but it can change blood sugar, it can change blood pressure, it can improve sleep, mobility, and overall health. And what we believe that every patient is different, and improvement still requires follow-up and long-term care. For longevity of this, you have to follow through with your surgeons, your primary care, and in some cases with the nutritionists. So, Dr. Ga, thank you again for joining us, and we'll be back with another episodes of Bariatric Friday. Until then, stay united. Bye bye.
United.